I'm in Gunnison, Colorado, a town that made it through the influenza pandemic of 1918 without a single death from the flu. An accomplishment that's even more incredible when you realize that this place should have been hit hard. In the early 20th century, this place was a popular railroad hub connected to Denver and other mountain towns that saw multiple deaths and hundreds of cases of influenza. It was also home to active silver and coal mining industries and a new college, which meant there were plenty of opportunities for people to spread the flu. But somehow, Gunnison saw 0 deaths during the pandemic. It's one of a handful of places that made it through the 1918 pandemic unscathed. The others were rural towns, small boarding schools, or military bases that were easy to isolate. But Gunnison caught my attention because it's a full-fledged town right in the thick of things. So I came to Colorado to dig through the archives, hang out at the museum, and figure out how this town dodged the flu. But to understand how they pulled it off, we need a little bit of context. The 1918 influenza pandemic was the deadliest pandemic in history. Between 50 to 100 million people died worldwide, with 675,000 deaths in the United States. And this strain of influenza was extremely contagious, and every major city in the US dealt with outbreaks of the disease from 1918 to around 1922. Now, usually the flu is deadlier for older folks than for younger folks, but this one was far deadlier for the young. And in 1918, big groups of young people were sharing close quarters in camps, trenches, and hospitals thanks to World War I, which gave the virus opportunities to spread. And thanks to the war, soldiers were constantly traveling between army bases and between countries. But the deadliest time frame in the pandemic for Americans was the second wave, which lasted from September to November of 1918, spreading across America from east to west. One of our most hopeful strategies was a vaccine. Scientists at that point had made vaccines against diseases like smallpox, anthrax, and diphtheria, so a flu shot seemed within reach. Unfortunately, we still had such a sketchy understanding of the biology of influenza itself. So back in 1918, our best strategy against a pandemic wasn't medicine. It was maps. Public health experts were able to combine the movement and location of troops with case numbers of influenza to predict where the pandemic would hit next. And after wreaking havoc on the East Coast in the late summer, early autumn, they were able to show that it was heading westward. And that's what brings us to Colorado. On September 20th, 250 soldiers arrived in Boulder, Colorado for a training session at Colorado University. 13 of those soldiers were sick with the flu, and soon afterwards, the disease spread across campus, then across town. Within a week, Boulder developed 91 more cases. A few days later, another trainload of soldiers came to Colorado Springs carrying 25 men sick with influenza. From those two towns, the virus spread across Colorado, which got the attention of state health officials and the governor, who issued a formal warning to the state on October 7th. A week later, the governor banned all public and private gatherings across the state, and Colorado residents were mostly supportive. They'd seen the kind of destruction that the disease brought to the East Coast, so they complied with orders. But out here in Gunnison, residents and local authorities took the threat of influenza even more seriously. Their first rule: no one comes to town without quarantining first. With so few ways into town, they knew that if the virus was coming to Gunnison, it would come through the railroad. So they stationed law enforcement at the train stop and subjected anyone who stepped off the train to a few days of quarantine. They also physically barricaded the main roads here and here, just in case. And it wasn't just a warning either. 2 men from Nebraska were arrested and put in jail when they tried to drive around the barricade and through the county. Another man tried to get off the train at Gunnison, get out of his quarantine, was arrested, and publicly made an example out of. The newspaper wrote his story on the front page, saying Gunnison had no flu and they didn't intend to have any. But cases were still rising in nearby towns, so the county physician decided to make the quarantine even more restrictive, blocking off not just the town, but the entire county on October 31st. In order that our lives and those of our families may be better safeguarded, I have caused a strict quarantine to be placed on Gunnison County against the world. Barricades and fences have been erected on all main highways near the county lines, lanterns at night, and signs by day warning autos to go through the county at once or submit to quarantine. F.P. Hansen, county physician. Okay, so on the surface level, that answers my question. Gunnison escaped the influenza pandemic without a single death because they enacted a super ambitious quarantine. But that raises another question. Quarantines need at least a little bit of buy-in from the people that they're quarantining in order to work. So how did they get the people of Gunnison to support the lockdown? Well, That's where the newspaper comes in. Remember, this is all happening at the tail end of America's involvement in World War I, so the federal government, as well as multiple local newspapers, purposely downplayed the severity of the pandemic in order to keep Americans confident in the war effort. In Chicago, Captain W.A. Moffett said, "While there are about 4,500 cases of the disease among the 45,000 Blue Jackets at the station, the situation in general is much improved. The death rate has been only about 1.5%, which is below the death rate in the East. And maybe so, but that's still around 50 dead soldiers." In Washington, D.C.'s Evening Star, Lieutenant Colonel Philip Doane said, "The disease is nothing more or less than old-fashioned grippe." This guy also tended to blame foreign enemies. Like, in the Washington Times, he said, "The Germans have started epidemics in Europe, and there is no reason why they should be particularly gentle to America." Others told folks to look forward to changing weather. Dr. W.C. Woodward told the Arizona Republican that the forecast of continued fair and cooler weather for Sunday led them to predict that there would be a marked falling off in the number of cases reported. But Americans were living a different reality. Their hospitals were overloaded and their loved ones were dying in front of them. Meanwhile, the newspapers were saying that there's nothing to worry about and that everything is fine. This caused more and more Americans to distrust the media. On the other hand, as soon as influenza was reported in Colorado, the Gunnison News Champion printed honest and transparent front-page stories about influenza every week. They also reported on people from Gunnison who had died of the flu elsewhere. They took a global problem and personally connected it back to their community, which, for the deadliest pandemic in history, is probably the appropriate amount of gravity to give the situation. Now, I went through dozens and dozens of boxes of letters to see if I could find out how regular people felt about the lockdown. But these were mostly letters to and from soldiers stationed in France, and none of them mentioned the quarantine. So if there was any kind of public outrage against the lockdown, I couldn't find any record of it. Regardless, that was the routine for 4 months. Wake up, do your work, stay informed, and try not to die. And it worked. For reference, the nearby town of Salida was rumored to have hundreds of cases in October alone. In Silverton, there were 125 deaths in a single week. And with a population of 130, the town of Sargent saw 6 deaths in one day. Now, there was one sick woman who came into the Gunnison train station, but she died elsewhere, which meant that the town of Gunnison made it through the first and second wave of the pandemic without a single case of influenza. In January of 1919, local officials met with the State Board of Health physician and decided to reopen schools across the county. Attendance wouldn't be mandatory, and there would be a physician there checking the kids for symptoms every day. But this was the center of a huge controversy, or much difference of opinion among the opinionated. So, Twitter today, basically. And on February 5th, 1919, Gunnison County lifted their lockdown from the world. The third wave came in mid-March, but this time, Gunnison didn't implement any additional lockdown measures. Luckily, the third wave was much more mild than the previous 2, so the entire county, there were only 5 deaths. Regardless, this little town made it through the deadliest wave of the deadliest pandemic in history without losing a single life to influenza. So, what's the point? Are there any practical takeaways from the Gunnison story for modern-day public health? According to historians at the University of Michigan, maybe, and only in specific circumstances. Quarantine can be effective if it's enacted early, if it lasts for the entire time that that population is at risk, and if that population supports it. And that's exactly what we saw in Gunnison in 1918. Otherwise, most of their strategies for preventing the spread of disease didn't really do anything back then. And while most of our non-pharmaceutical interventions are the same as back then, like masks and social distancing, the big difference is that pharmaceutical interventions are way better than they used to be. That's why there's such an emphasis on vaccination for modern pandemics and less reliance on masks and quarantines. Now, we're heading into my personal opinion territory, but to me, the difference between Gunnison and other cities wasn't the quarantine, it was their communication, right? There was no doctor or medical invention that saved the day. The real star of this story is the newspaper. The Gunnison News Champion did the best with the information they had. They relied on experts and they didn't try to cover anything up. And in the end, they earned the trust of the people they were trying to communicate with. The lesson to learn from Gunnison is that people respect honest and clear communication, regardless of whether the message is good or bad. But that's just my takeaway. What is the lesson to learn from Gunnison? Let me know in the comments. If you want to hear another story about public health and how we manage pandemics, go ahead and click on this video right here. Otherwise, thank you to all my patrons on Patreon. Have fun, be good. Thanks for watching.